Welcome to Medically Speaking. My guest today is Mark Mineo, the director of the Millard Fillmore Surgery Center. Mark, thanks for joining us today.
Thanks for having me, Mike.
So let's start out, talk a little bit about the operation there itself. And for those who may not know, let's start with the difference between the surgery center and the hospital itself. Obviously, you're aligned with Millard Fillmore Suburban Hospital, but in a nutshell, what is the surgery center? What's the location?
So we're located at 215 Klein Road, which is basically the backyard of Suburban Hospital. Millard Fillmore Surgery Center does ambulatory surgery. So the only surgeries that we do here go home the same day. So when our patients arrive in the morning, they're seen by our nursing staff to get ready for surgery. They go into the procedure, they go into a post-op area, and then home, all within a few hours of when they started the day.
So when you talk about same-day surgeries, give us an example. So we're not talking high-end, tertiary type procedures. Give us some examples of the types of procedures you guys do there.
Yeah, so we tend to have lower acuity cases, which are knee scopes, most ENT cases, some cosmetic surgery.
So you mentioned the nurse, you mentioned the physician. So are these the staff, the surgeons, are they aligned with the hospital itself?
Yes, most of them are credentialed and privileged within Kaleida and the surgery center. If they can do their ambulatory cases in the surgery center, they tend to prefer it because we tend to be more efficient just because our footprint is smaller and we're more cost effective because of that.
Gotcha. And you mentioned some of those key procedures that you do. There's some things that you guys specialize in terms of, from a volume perspective. What are the 2 or 3 most types of procedures that you guys do?
We do a lot of orthopedic, arthroscopic procedures. So that's anything with the scope. We do pain management with pain injections. So we can do up to 30 of those in about a half a day. Plastics and reconstruction, so cosmetic procedures. And we also do some ENT and general procedures.
So for those types of procedures, 5-10 years ago, those were performed in the hospital. Why have they moved to the outpatient setting? Why is it better for the patient these days?
A couple of things. That's a good question. And that's changing basically on a daily basis. Because of technology and smaller incisions, it's less invasive. So again, there's less healing involved. And at a surgery center, there's less probability for infections, just again, because you're only here for a short period of time. And in a hospital, you have sickly patients that are sharing the floors.
And again, you mentioned the staff before. What's the typical makeup of a surgery center in terms of the staff that may be working there?
Yeah, so it's basically the same as a hospital. We have our own surgical scheduling. We have our own pre-op unit, our operating unit, which is our ORs. SPD, those are the individuals that take care of our instrumentations, and the PACU, which is what gets the patients ready for discharge after anesthesia. But we also have our own administrative staff and support staff.
How many operating rooms you guys running these days?
We have 6 operating rooms and 3 treatment rooms. So the treatment rooms, what we call quote unquote lump and bumps, and then 6 OR rooms, which are general anesthesia.
And for cases like lumps and bumps, give us an example of that. And those are obviously the lower end acuity. What are some examples of those types of cases?
So people getting cyst removed or mole removed, we can do anywhere from 3 to 10 of those in a very short period of time because there's no anesthesia and no recovery.
And so for the higher end cases, even those with higher acuity, let's go back to maybe pre-COVID and post-COVID, and just maybe overall for the ambulatory surgery industry. You've been at this for a while. What have you seen the last 2, 3, 4 years coming out of COVID in terms of the transitions in care and where surgeries are being held?
Yeah, it was interesting, my role during COVID, because we went from a surgery center to a possible ICU unit, then to an OR for ambulatory cases that we normally don't do, but are able to do for the pure fact that the ORs at the hospital were not allowed to do the procedures. So coming out of COVID, my staff especially is more confident doing procedures that we never had to do just because we could and we did. Outside of COVID, surgery centers are doing more and more, because the payers are starting to push some of that out, but also with the advancement of technologies, things can be done quicker, like total joints can be in and out they take a couple more hours, but nonetheless, they're in and out the same day.
That makes sense, especially from the patient perspective, but also from a surgeon's perspective. You talk about it being more efficient. So you guys are an extension of the hospital, but really more of a, I wouldn't say 9 to 5 operation, but a daily operation. So in terms of physician preference, if they can do these procedures in an outpatient setting, they're going to want to do that.
Yeah, for sure. We're much more controlled setting. You could say we have controlled hours. Our first staff shows up at 6 just to get ready for the day, but our operating rooms run from 7:30 to 5, and our PACU nurses get out a little bit after that. They don't have a true set time. They're done when the last patient leaves. So it's much more controlled, which makes it much more cost effective also. We don't have surprises. We don't have many surprises that we can't control or not ready for.
And the benefit of being aligned with the hospital, obviously, separate ownership, but you're aligned with the hospital. The benefits of being aligned with the hospital and even a larger health system. Talk to us about that.
Yeah, we're really starting to leverage each other, which is great. I have a great relationship with Suburban. So if we get in a pinch, especially with all the supply shortages and boats being caught offshore, I'm able to go over to Suburban and borrow anything from sterile water to a disposable without having to worry about having to cancel a procedure, which at the end of the day affects our patient care. So as our relationships build, we're able to leverage each other to help each other out in any way we can.
And part of that leveraging is obviously, you mentioned it during COVID, you guys can actually help them scale up for some sort of influx of patients, or in this case, we ended up with a pandemic. So works both ways for you guys.
Yeah, that was a great team effort. How quick we were able to not only do the procedures, but we had to get the physicians credentialed for our surgery center. But again, being part of the Kaleida, that was more of a paper shuffle as opposed to having to do a major lift, which credentialing and privileging takes some time to go through.
Sure. So as you look out, what's the future of ambulatory surgery in Western New York? It seems like incrementally, there's new locations popping up. But in terms of, where surgery's headed, especially things like orthopedics, where do you see the ambulatory surgery industry going?
Growing exponentially. People are more confident in the technology. Patients are more comfortable. It's not a new thing anymore. And we're just going to see it grow. I know some centers are actually starting to do some cardiovascular and vascular work within surgery centers, which was unheard of maybe 10 years ago. Total joint used to spend 3 days in a hospital. A total knee can go home in 4 hours now.